Hello there! Today we'll be deliberating on the topic ectopic pregnancy and why it is life-threatening. Welcome to Your Health Today with Dr. Yide, where I talk about your health and wellness. I am Dr. Etiology. If you're not yet subscribed to this channel, I think you're missing out. Why don't you do that right now and hit that notification bell so you get notifications every time I post new videos. Now straight to the chase. What is ectopic pregnancy? The word ectopic has its origin from the Greek word ectopos, meaning out of place. So ectopic pregnancy is any pregnancy that occurs anywhere but the uterine cavity. Meaning it could be anywhere but the uterine cavity where it should be normally. Could be in the cervix, could be in the fallopian tubes, could be on any of the ovaries, could be within the abdominal cavity. Well, it is quite common. In Nigeria, statistics have shown that we have 1.5 to 2.7 cases per 100 deliveries. That is very common, meaning you have an average of 2 cases per 100 deliveries. There are a lot of risk factors that can actually lead to ectopic pregnancy. One of them is tubal damage, tubal in the sense of the fallopian tube. And the tube can be damaged from a poorly treated pelvic inflammatory disease. It could occur from a previous history of ectopic pregnancy, meaning a previous history of ectopic pregnancy can predispose yet another. Smoking cigarettes. It's been discovered that when women smoke, there's a tendency for reduced tubal motility, meaning the movement within the tubes reduce, causing or increasing the probability of an ectopic pregnancy. So smoking cigarettes can actually predispose you to ectopic pregnancy. Altered tubal motility, I spoke about that earlier. Now things that can further alter the tubal motility, reducing the tubal motility, are the use of hormonal contraceptives or even the IUCDs, intrauterine contraceptive devices. Also, an increase in age. The older you get, the higher the probability of you having an ectopic pregnancy. Not to say that ectopic pregnancies don't occur in younger women, but the age, the older you get, the higher the possibility of having an ectopic pregnancy. Now the very last step I'll talk about today is DES, diethylstilbestrol. Now this is not very common now, but when women are exposed to diethylstilbestrol, especially in utero, can predispose women to having ectopic pregnancies in the future and even recurrent miscarriages from a very shortened cervix due to the exposure of the diethylstilbestrol. In the not too distant past, diethylstilbestrol was very common. It was a routine drug given to pregnant women, especially around 1971. It was given to pregnant women then to reduce the risk of complications during childbirth. But now we know better, so it's no longer in use. But if you are one of those women who were exposed to it while you were in your mother's womb, there's an high incidence of ectopic pregnancy and recurrent miscarriages due to a shortened cervix. Now there are 3 cardinal signs that you mostly see in women that have ectopic pregnancy. The very first one is abdominal pain, amenorrhea. Amenorrhea means you miss your period. Then number 3, vaginal bleeding. Now I'll sign this note of warning. Less than 50% of women actually present with all these 3 symptoms. Some women never bleed. In fact, the only symptom you might even present with is that you miss your period, alongside other things like an abdominal pain, things that you see with a normal uterine pregnancy. Other symptoms that a woman might have are syncope, that's loss of consciousness, or you call it fainting, dizziness or weakness, fever, flu-like symptoms, and vomiting. When you hear of a case of syncope, meaning passing out, in a lady of reproductive age, the first thing that should come to your mind is the possibility of an ectopic pregnancy. There are other things, it could be an illicit abortion and all that, but you should always think of the possibility of an ectopic pregnancy because it is a common cause of death in pregnant women. because you might miss the diagnosis and the woman keeps bleeding and can lead to anemic heart failure. These things are completely avoidable. Please do not miss these signs that have been stated. An ectopic pregnancy can be discovered incidentally during a routine ultrasound scan. You go to your GP or go to a lab, do an ultrasound scan and find out that you're pregnant, confirmed from a pregnancy test, but the pregnancy is not found in the uterus, within the uterine cavity. Then the sonologist or sonographer looks at the adnesia, that's where your fallopian tubes and the ovaries are, and sees the gestation there. That's an ectopic pregnancy. If it's not ruptured, yes, you don't have to do a surgery. Go see your GP for urgent treatment. But if it's ruptured, it is an emergency and needs to be operated immediately. So it can be diagnosed by first detecting that you've gotten pregnant by taking a serum pregnancy test. That's the beta HCG test, the regular test you do for pregnancy, and a routine ultrasound scan. Could be a trans-abdominal ultrasound scan or a trans-vaginal. I usually recommend a trans-vaginal because a trans-vaginal ultrasound scan is actually more accurate for detecting early pregnancies. An ectopic pregnancy can be treated medically or surgically depending on how it presents. If it is found incidentally, meaning it's not ruptured yet, you can use the drug methotrexate. Your doctor will prescribe it the way it should be used. But however, if it is ruptured and you started bleeding, it becomes an emergency surgery. So you do either a laparoscopy or an open surgery. But please, the essence of this video is to ensure that you do not decline a surgery whenever your doctor recommends a surgery for you. This is life-threatening. We've seen people die from this thing due to stubbornness. That is the essence of this video. It is an urgent thing. It is life-threatening. You might think you're fine, but please always listen to your GP. At least get a second opinion if you don't trust the first doctor you've seen. Well, I can't say an ectopic pregnancy can be prevented totally, but remember all the causes or risk factors we mentioned earlier. Try to avoid them. Like if you have a pelvic inflammatory disease, what we typically call infection, ensure it is treated properly. Always do a repeat test to show if you're fine. Avoid smoking if you're a woman and you desire to have children. Most importantly, always ensure you have yourself checked the moment you get pregnant. The moment you miss your period, you need to see your GP or your gynecologist. Ensure that an early ultrasound scan is done to ascertain the location of your pregnancy. It must be within the uterus. If it's found outside the uterus, it's an ectopic pregnancy and must be treated immediately. If you just loved this video, I would have you like, post a comment, share, and subscribe to my YouTube channel. So we'll meet again, same place, same time next week. Don't forget, health is wealth. Bye.